Hello, my name is Alyssa Cummings, and this is my Module 6 Health Assessment for the Musculoskeletal Strength and Neuro Assessment. We're going to start with the musculoskeletal and the strength part of our assessment first. What we're going to do first is we're going to test the TMJ. So I'm going to take my two fingers and I'm going to put it in front of the tragus of the ears of my client and just check overall range of motion for any clicking and popping. So I'm just going to place my fingers here. Does this hurt at all? No. And I don't feel any swelling. So I'm going to have you open your mouth and close your mouth and move your mouth from side to side for me. Awesome. So she has full range of motion of her jaw and just a slight popping but no clicking noise, which is exactly what we want. Next, what we're going to move on to is the base of the neck and the top of the spine. So you would come over here and you would feel very lightly for any tenderness, pain, swelling, nothing. And I don't feel any swelling, which is perfect. So what you're going to do is you're going to start by doing range of motion again. So we're going to have the client flex our head, yep, extend way back, yep, and then put each ear down to the shoulder as much as possible. Awesome, and does that hurt at all? No. No. So she has full range of motion of her neck as well, but another part of it, especially for the neck, is strength. So what I'm going to do is I'm going to put my hand right here, yep, and I'm going to have the patient push up against my hand as best that she can. And then I'm going to put my hand back here and have her push up against that as well. So she has +5 for strength as well. Next, what we're going to do is I'm actually going to have our patient turn this way for me. And we're just going to take a look at her spine. So basically what we're doing is we're taking a look at her cervical, her thoracic, and her lumbar. So her cervical, you want to see concave. Thoracic, you want to see convex. And lumbar, you want to see concave again. And the next part, what we're going to do is we're just, by using the fingertips of our fingers, we're just going to go all the way down and feel for any tenderness or pain. Nothing? Awesome. Okay. And next, what I'm going to have you do is I'm going to just have you bend forward and touch your toes as much as possible. And I'm going to just follow her spine all the way down. Basically, what we're looking for is any signs of scoliosis or deviation, which she has none. You're all set. And now what I'm going to have you do is I'm going to have you face the camera. And what we're going to do is we're going to put our hands up by our side and we're going to do lateral flexions like this. And we already know that you can bend forward just fine, so extend backwards. Awesome. So she has full range of motion of her spine as well. The next part is we're going to take a look at the shoulders. So you would do everything from here on out, you would do bilaterally, but for the sake of the video, I'm just going to do one side. So I'm going to start up here, and I'm just going to feel for any tenderness, swelling, or pain. No? Awesome. So what we're going to do is we want the patient to flex her arms for us. Flex and extend. Yep, sorry, get out of your way. Flex, extend, and then hyperextend, which is way in the back. This shows range of motion. And then we're also going to test her strength as well, just like before. So I'm going to have you put your arm out in front for me. And the same thing like with your neck, I'm going to push down and you're going to push up. Excellent. And now I'm going to push up and you're going to push down. Excellent. So this client has a +5 strength for her shoulder as well. Now moving on to the elbow, what we're going to do is you just start by looking at the elbow. No lacerations, no redness, doesn't look like any swelling. Do you have any tenderness? Any history of any problems? No? All right, awesome. So we're going to start by extending our elbow. Yep, and then I don't recommend hyperextending because that will hurt. And then flex your elbow. Yep, and then we're going to do this, we're also going to do supination, which is when your palms are up front, and pronation. Yep, so this shows that you have full range of motion of your elbows as well. And as we did before with the strength, pushing down and pushing up shows that she has +5 strength of her elbow as well. Now we're going to take a look at your wrist. So just very simple, you basically just want to look and see if the wrists are symmetrical, if there's any lacerations, deviations, any visible deformities. And you're just going to feel around a little lightly and just ask the patient once again if there's any tenderness or pain. Awesome. And then at the same time, just take a look at the fingers as well and look for any visible deviations in the fingers, if there's any pain, sign of arthritis, redness, anything like that. And I don't see anything like that here. So with the wrist, what we're going to do first is we're going to do range of motion of the wrist, and then we'll move on to the rest of the fingers. So we are going to flex our wrist first. Awesome. And then extend our wrist. And then we're going to do radial and palmar radiation. So radial is in and palmar is out. This basically just shows that she has full range of motion of her wrist, which is exactly what you want. Some people who have carpal tunnel won't have full range of motion of their wrists. And then strength, what we do is same thing that we did before. She's going to push up against and then push down. Awesome. All right, and now what we're doing is we want to take, even though we already took a look at her joints of her fingers, we also want to test the range of motion and the strength of her fingers as well. So what we're going to do is we're going to flex our fingers. We're going to extend our fingers. We're going to, from extension, we're going to abduct and then adduct. Perfect. And then in order to check the strength of her hands and of her fingers, what I'm going to do is I'm going to place 2 fingers in her palm, and I'm going to ask her to squeeze them. Excellent. And you would do this bilaterally too to make sure that the strength is symmetrical in each hand. And then in order to check the strength of the thumb, you have the client take the thumb like this and bring it in like that, and then make an OK sign. And what I'm going to do is I'm going to put my fingers in here, and I'm going to try and separate this, and you're going to stop me, okay? Perfect. So she has +5 strength in her wrists and her fingers. The next part of our health assessment, we're going to check out the hips, the knees, the feet, and the Achilles tendon as well. So after palpating for tenderness, pain, swelling of the hip, we're going to do a range of motion and check the strength of the hip. So what we're going to do first is we're going to have our client actually lift her leg as high as she can go. There we go. And then down. And then we're going to have her bend her knee, and yep, so she's actually showing flexion of the knee and the hip right now, and then out again would be extension. So what she's doing right now is external rotation, and then we're going to have her move in this way, and it'll be internal rotation, and that also shows full range of motion of the hip. And then finally, the last part is abduction. So she's going to actually, kick her leg out to the side and then bring your leg straight forward back in, and that's abduction. This shows full range of motion. So next what we're going to do is we're going to check the strength. So same thing as we did with the shoulders and the wrists and the elbow. We're going to start by putting pressure on the top of her leg and having her pull, kind of kick up. And then we'll do it on the bottom and have her push down. And then we'll also check the outside and the inside to make sure that she has full strength. Okay, so go ahead and kind of kick up towards me. Good. And then kick down for me. Good. Push up against me. Awesome. And this way. Awesome. So that proves that she has +5 strength in her hips and full range of motion of her hips and her knees. So moving down after, you want to make sure that there's no tenderness, swelling in the rest of her joints as well. So you would take a good look at her knees bilaterally and make sure that they're symmetrical. Notice any deviations, ask for any pain, tenderness, and then from there you want to move down and look at her, yes, thank you, look at her ankle and her Achilles tendon. So basically you just feel right here, there's no swelling or tenderness.